Have you started your period unexpectedly at work, your gym, or your alma mater and not had a period product? Maybe they were blocked by a coin-operated period product dispenser. Well, it doesn't have to be that way. I'm Claire, the founder and CEO of Aunt Flo, and we stock over 60,000 bathrooms with our freely accessible period product dispensers. Learn how to get our products at your organization at auntflo.com.
Welcome to the Heart of Healthcare podcast. I'm Halle Tecco.
I'm Michael Esquivel.
And I'm Steve Krause. And every Monday, we bring you the latest in healthcare innovation as we sit down with entrepreneurs and industry experts.
So buckle up and join us as we figure out how to improve healthcare for all. Hello, listeners, and welcome back to the show. I'm your host, Halle Tecco. I'm here with my co-host, Steve Krause, for your November 2025 Digital Health Download. Steve, where has the year gone?
That's exactly what I was just thinking. I cannot believe it's almost the end of the year. You know, you get to November, it's like the holidays, and we're there.
I know. We've had so much happen this year, too. It feels like we've crammed a decade of progress into the last 10 months. So with that, we have a ton of stories. Why don't I kick it off with a really great report that just came out, the SVB report. It's called The Future of Health Tech 2025. And they looked at where investors, innovators, and clinicians are placing their next bets in healthcare. And there were a lot of things that were actually not surprising to me in the report. Let me tell you a few of them. So health tech is moving from growth at all cost to evidence and efficacy. As we all know, the frothy funding era of 2021 is long gone. And in its place, we're seeing companies focus on profitability, clinical validation, and integration into existing workflows. Also not surprising is that funding is pretty flat year over year. We're not shattering any records. However, the authors did say that health tech is getting a bigger portion of VC dollars in 2025 than ever before. And then last, not surprising is that the report found that most AI funding dollars are going towards infrastructure, things like clinical documentation, coding automation, risk adjustment tools, etc. Rock Health's funding report also recently came out, and they counted 7 $100 million plus rounds in Q3, 4 of which are AI solutions, and nearly all are AI enabled. On the ground, it feels like you are either an AI company in healthcare that is raising a huge round at a very generous valuation, like agentic AI startup Assort Health, which raised $76 million for their Series B just 5 months after raising a $22 million Series A. Or you're a company trying to figure out how to spin your company's narrative to become an AI company, because that is the space that is very hot right now. Steve, you talk to a ton of founders, a ton of investors every day. Has having an AI strategy basically become table stakes for health tech companies right now?
I thought it was a great report. I do think there is a market of haves or have-nots. I think part of that is because people see the opportunity in AI. And I think part of it is just because we've been through a period where a lot of money was put into tech-enabled service, value-based care companies, and it's still unclear how those are going to play out. And for sure, those models, the tech-enabled service, value-based care company models, are less capital efficient, in the nature of the business models and the build that you have to make, and the fact that they're more services than tech, right?
Yeah. However, on that, I mean, we've seen more M&A of healthcare services companies than
historically, healthcare services has had a bigger market TAM and more exits than healthcare IT. Healthcare IT traditionally has been a very small part of the market because the industry has been so slow to adopt technology and automation. Now, maybe this time is different. I think that's, what all the excitement is, both on the entrepreneurial side as well as the venture capital side. But I think it is true, Halle, that it's tough out there right now to be raising capital if you're an AI company. Now, I think what I'll say for those who aren't AI companies is 2 things. One is I think you need to think about all parts of your business and where you can integrate AI. I think that's true for every business, regardless if you're in healthcare or not. You should be thinking about that. And I encourage everybody to see where they can, make their business more efficient that way. But I'd also say just don't fake it. Like, I think those pitches where it's clearly a services company and they're trying to now make it an AI company, they just don't ring true. And
you can tell.
You can tell. And I also, markets are fickle. I do think this time is different. I mean, let's hope, because I think the potential here is large and there's obviously a lot of capital being put behind it and people are staking their careers on it, including me. But the value-based care market, I think, will come back. The tech-enabled service market, there have been a couple bellwethers out there. We've talked about them, Hinge and Omada. Who knows what that looks like in 5 years. So my advice to, entrepreneurs who have tech-enabled service businesses is to integrate AI, but don't try to fake it until you make it. Just be genuine, because investors, you want a genuine investor and investors want a genuine entrepreneur, and it is what it is, and you never know how markets will change. So that's one thing on that point. I think the second thing, the only thing I'll disagree with on the report that you mentioned, Halle, which is is that these businesses are more efficient. And I'm not sure yet we've proven that these AI-enabled services businesses are more efficient. Like, they're raising a ton of capital and they're burning a lot of money. And so, in theory, the automation should make it more efficient. But a lot of these businesses, frankly, look a lot more like services business at first, that are human in the loop,
Consulting.
And then they're going to use they're going to build an agentic agent and replace the human in the loop. Like, that's the idea. But the amount of money that's being raised looks a lot like the bubble raising for these tech-enabled services business. So again, the beautiful thing about what you and I get to do is we're not public markets. We're not trading in and out every day. We get to see these things develop over time. So I think that's a question mark, and we'll see how that plays out.
It is. And while we're still in my first story, I do want to reference a third report that just came out, which was from Greg Yap at Menlo Ventures. Have you seen this one yet?
Yeah, I did. Yep.
Two fascinating things. One was that just the average buying cycle has shortened 18% for health systems and 22% for outpatient providers. So the adoption is faster. And also, shockingly, 85% of AI spend from health systems is going to startups and not the incumbents. The startups are the ones that have innovated and have the products available, but can they then create a moat, because they don't have the sort of piping and infrastructure that the incumbents have?
Obviously, as you noted, a lot of money has been poured into the hospital back office, right? Scribing and coding and the like. But this month, there was a lot of news about the raise that Open Evidence just had, which was a $6 billion valuation, was announced this week at Health, and had previously raised at a very attractive valuation, I think $3 billion, only a few months before again. Yeah. So there's definitely heat in this market. But what Open Evidence is doing is basically trying to replace UpToDate, which is a long-standing, almost monopolistic business that every single doctor that I ever saw used all the time. That was like a physician's reference desk book, a clinical decision support tool. If, you reported to your doctor that you had a rash and, elevated heart rate, they would actually enter that into UpToDate historically on their desktop. And UpToDate, which was bought by Wolters Kluwer, basically created a compendium of all the great academic texts in medicine, right? It basically UpToDate replaced textbooks, and Open Evidence came out. Great founder who had been a tech founder before came out and was like, well, we can now use AI and LLMs to basically crawl the universe of medical literature out there and create a much more rich and context-aware clinical decision support tool for doctors. And Open Evidence, by the way, has had incredible growth. Basically, it's went from 0 to 40% of doctors in the U.S. using it in like less than a couple of years.
They claim to be the fastest growing provider tool since the iPhone.
That's amazing.
Yeah.
So they obviously raise money. And I think it's interesting now that we're getting a little bit more into the clinical domain, not just the back office domain that, the report you mentioned, SVB's report referenced. But to your point about who's going to win here, Open Evidence has a big war chest. UpToDate just a couple weeks ago announced, for a while they were sort of sitting on their laurels. They are the 800-pound gorilla in this space, if you will. They announced that they're now going to have an AI strategy. And they believe that their AI strategy is going to be better because they're actually only using LLMs against their compendium of medical literature that they have internally through Wolters Kluwer, which is a huge publisher. Whereas Open Evidence, which is crawling the web, might have more hallucinations and might more false signals. So they announced a strategy. And then just this week at Health, Abridge, which started off as a scribing company, which is in the clinical conversations, by the way, one of our great portfolio companies, announced that they're also partnering with Wolters Kluwer's to embed presumably what is the same medical literature into the clinical conversation, the note-taking. So when you scribe, actually it'll pop up if you say patient is presenting with a rash and asthma, rather than have to go to any second portal or website or go to Open Evidence, it'll just automatically pop up the CDS in the abridged note. And then you have the question of like, what's Epic going to do, to your point? Because clearly Epic has the most rich set of data, right? Yeah. In that they have all the clinical records longitudinally. And while they haven't done anything yet at their UGM, which we talked about a lot on the show, they announced lots of different initiatives, but one of them was to go after the CDS space. So to your point, we've been fighting the battle for the last year or two in the RCM space in startup versus incumbents. And now we see this battle coming to the clinical decision support space. I'm curious, two questions for you, Halle. Where do you think more money will be made? Will you think it'd be made more in the RCM space? Follow the money has never failed in healthcare. So that's always been a rich gold mine, if you will, or in the clinical decision space long term. And who do you think is going to win this clinical decision support war?
Let me just tell you, I love this era of digital health. There's just like intellectually, it's so interesting to see this all play out. And it feels like
in real time. It's not like it used to be you and I would be like, oh boy, it's not going to be another 2 years till some innovation.
3 years from now. I mean, more has happened in innovation in healthcare this year than like our entire career combined.
Yeah.
Like it really feels
and you and I have
like
been doing this for what, 20 years?
Yeah. Well, a little less for me.
I aged myself,
Okay, first of all, I want to say I love seeing this competition. As someone who is not an investor in any of these companies, I can just say this. Like, I love seeing this competition because it means that all of these players are going to step up their product innovation. They're going to drop their prices to compete. Competition is good for outcomes. And so I'm super excited to see all these players.
You said it's good for cost. I agree with that. Like, obviously, competition generally means commoditization, but you think it's good for product too.
Oh, it's so good for product. Oh, absolutely. And this is the first time where we're actually seeing these big players look around at the startups and say, oh, wow, these startups are getting 85% of AI spend. I better start investing in building new features. I can no longer rest on my laurels. The other thing I want to say, and then I will answer your question, is that for folks listening, highly recommend listening to the Abridge episode that we did with Shiv earlier this year. We also last week had up-to-date expert AI Dr. Holly Urban talk about kind of what they're doing there. And then in a week or two, we are going to release the episode with Open Evidence co-founder and CTO. What's so cool about this is that like what we're talking about now, we've had the chance to talk to all of these folks and kind of get their insights. Is there room for more than one clinical decision support tool? Maybe there is, right? Like I use ChatGPT sometimes and Gemini sometimes. So there's maybe clinicians will have multiple tools that they use for different things, but more than likely, if they think that up-to-date expert AI is as good as Open Evidence, which what I'm hearing is yes, it is. Clinicians are really liking it. I do think that being part of the workflow will win over the doctors, right? Yeah. Because it's just going to be more seamless. They're doing all these very cool partnerships, like you said, with Abridge. And so up-to-date is just like, it's easier, right? All else equal, you're going to use the tool that is like embedded within your everyday workflow. So I do think that there's like the distribution is valuable there. What I think, and this
I also wonder how, by the way, to your point, will like enterprise buyers like CIOs and CMIOs, they are, at least historically, have been like the gravekeeper for startups, right? Because they can always say no. And I wonder from a liability perspective, right? Because the clinical decision support is like, okay, Halle told me about this. Dr. Steve Krause looked to this compendium to figure out what it was. Like, will they want to have one
control?
Yeah. Will they have want to have one control versus?
It's so interesting that Open Evidence, and I talked to Zach about their distribution strategy, going direct to doctors versus going through their employers, which is fascinating, which is what helped them grow. But where I see a big opportunity for them, honestly, and I said this to them on the show, which you'll hear in a week or two, is like they need to have a consumer product. To me, like that is like, it is, I have it on my phone. It's excellent. I really do like the product. My clinician friends that use it also really like it. And that's how they started out. That was their initial vision when they pitched it, was a better WebMD. And I think there's still a big opportunity there. And they're so good at product. And I don't think they have any interest in building enterprise tools. So that's where I see them playing. I think there's room for everyone. Do I think there's room for everyone as a clinical decision support tool at the point of care?
Maybe not.
Probably
But
not.
interesting you make the consumer point because, it's always been amazing to me, like Google, right? Which is the world's greatest company in terms of its business model. I think I heard somewhere between 15 and 20% of searches on Google are medical. And, I've had a few chances to talk to Google executives off the record and like sort of intimate conversations. I've always been like, why the heck don't you invest in Dr. Google more? This is like pharma spend that you'd get. And I think there's really two reasons. One, they said they're very worried. They really worry about all the red flag incidences that they have. They have a lot around mental health and specifically suicidality, and they worry about that. And I think it's also because some of these consumer companies, it's going to be the thing that ChatGPT and Anthropic, who want to make a play in healthcare, are going to face too. It's like the other 80% or 90% that's non-healthcare. That ad-driven business model has been so profitable. I mean, Google is one of the world's most profitable companies. Do they want to cook the golden goose by the risk of potentially having a Wall Street Journal headline that somebody killed themselves because of some bad reference that they got from their CDS tool?
But it's happening in ChatGPT already.
No, my point being, though, Halle, is like there's an opportunity. There's a white space because the incumbents actually have 100%. Well, we talk about regulatory capture for incumbents, and they take advantage of it. They have a big regulatory risk, I believe. And I've always wondered why Google in the boardroom isn't pushing more on healthcare. And I think I don't have any proof that this is the case. This is Steve Krauss intuition. I think it might be that. And I think there might be a white space, to your point, for like an open evidence to create a consumer focused tool.
And like a Google and a ChatGPT, they're going to be training off of like the entire internet, where at least open evidence is training on medical journals. And they have, I think, a pretty good way of ranking the journals. Not every study is created equal. And I think they've actually figured out how to surface the most meaningful evidence. I would love to see them do a consumer product. In the meantime, I don't know how long I have access to it, but I have access to it.
Yeah, and the benefit of being a star podcaster, you get free access.
Right? Send me the free products. Yeah, so it's interesting. I mean, it's a really interesting time. And right now, innovation is winning. As we said, 85% of AI dollars are going towards startups. So innovation is winning right now, but the incumbents are not dead. They're just late.
Yeah, and you didn't even mention the biggest incumbent. Like, I don't understand how Epic could cede this ground. Yeah, how are they going to? This is like you're in the note. Like, how do they not have a CDS product now? How are they just like they decided they weren't going to lose the scribing war, which they decided that, by the way, they decided that late too, because they did cede ground to Nuance and Bridge. And those companies, Bridge built a really big company for over a couple of years by working with Epic. Like, is Epic going to cede the CDS ground now? That I don't think so. I don't think so.
And Epic doesn't grow through acquisition, do they? I can't think of a company.
Judy won't do it. She hasn't done it.
Yeah. Well, I mean, this actually might be what kills Epic then. Like they need to, if they're not able to innovate fast enough in today's market, then they might lose out. Like I heard what you asked Clay Bavor in that episode 2 weeks ago about how you can move.
Yep.
From Sierra. Yeah. I mean, so people should go back and listen to the episode if they haven't yet. But you asked them about that. If you are a system of action, do you end up becoming the system of record in the value? So then you kind of like back into having all that data. I thought his answer was brilliant on that. California just became the first state to pass a law regulating what are called companion chatbots. These are AI systems designed to create human-like social interactions. You can think of emotional support bots, virtual companions, not just like your standard customer service chat like Sierra AI. But under this new law, any company offering these kind of chatbots, including ChatGPT, to users in California will have to follow new disclosure, safety, and reporting issues. So here's what it means. First, disclosure. If a reasonable person might think that they're talking to a real human, if it feels like having a conversation with a friend, the chatbot has to clearly say it's artificial and that it's not a person. And for minors, there are extra rules. If the operator knows the user is a minor, the chatbot has to tell them it's AI. And then, I actually really like this, every 3 hours, remind them to take a break and remind them again that it's not human. And every chatbot platform also has to include a notice saying that it might not be suitable for minors. And then there are safety protocols. So companies have to make sure that their chatbots don't produce or share content related to suicide, self-harm, or any sexually explicit material involving minors. And if a user expresses suicidal thoughts, the chatbot must respond by referring them to a crisis service provider, which already happens on Google. It's shocking that this isn't already happening within these chatbots. And then the companies have to post their safety protocols publicly on the website. And then finally, there's reporting. So starting in 2027, which is a millennium from now in AI time, but chatbots operators have to file an annual report with the California Office of Suicide Prevention. And the report has to include the number of crisis referrals made that year, the details about the company's detection and prevention systems, but without any of the personal data. And that'll be available for anyone, for us, to have that data. So if someone is harmed because a company doesn't comply, they can actually sue, and they get at least $1,000 per violation or more if damages are higher. So, Steve, California often sets the tone for tech regulation. Do you see this as part of something starting a national trend? Do you think this could become something at the federal level? This is new.
The law here what you just read doesn't seem unreasonable to me. California is not known as the most. It's known as a high regulation state, but everything you just cited off seems like appropriate and kind of what I would want for our industry and hope that our company is designed for. I think the concern I have, Halle, and this is going to relate to more federal policy or the lack thereof, is it seems like right now the administration, when it comes to AI, is taking a very entrepreneurial friendly, innovation friendly, like low regulation stance towards AI. Like David Sachs, who's the AI czar, who comes from our world, Silicon Valley world, is basically it's like, just let everything rain and we'll see what happens. And my worry about that, and frankly, actually, we had Brian Anderson from the Coalition for Health AI on a podcast several months ago. I thought it was an interesting one about their work around regulatory frameworks. And frankly, that organization recently has gotten a little bit of a spat, and they're trying to resolve it with the Trump administration because they're basically claiming that Chai has been supported by large tech organizations who are trying to create a regulatory cartel and regulatory capture. And what Chai's point would be, just to show both sides, is actually we're trying to create a federal regulatory schema because we don't actually want 50 different states having 50 different regulatory policies. I'm not always like we should have tons of regulation, but I do worry in the health AI space, if we don't have some kind of framework, when shit goes bad, and stuff is going to go bad. Like, it's just the nature of innovation.
Has.
Like
things people lose their lives.
Right. Like things break, right? And I worry if there's too much of that, we're going to have a very reactive 50 state-based policy. And I'm not sure that's great for innovation, right? Because if you're an entrepreneur and you have to think about, I got to go want to market my product in California and Maine and Arkansas and Alabama, and they all have different regulatory frameworks, like that's going to be a nightmare. Like, think about, it's going to be great for lawyers, but I'm not sure it's great for innovation. So I think this is a really interesting story because it got me thinking, like, good for California, and yet we kind of need some kind of like federal schema so that we don't have 50 different ones.
Yeah. Yeah, I agree with that. If I were a regulator in another state, though, I would think, like, why don't we just piggyback off what California is doing?
They can't help themselves.
They want to make it their own idea.
No, and by the way, you have all these different constituents and lawmakers, and that just doesn't lead to I think it leads to 50 different flavors. Maybe not 50, but there's at least going to be 5. Yeah. I don't think that's ideal. So I like this. I actually think this is good. I want guardrails because we can't mess up in healthcare.
And with my public health hat on, I'm excited to see what these companies start reporting on what they're doing, right? We'll have some transparency into the steps that they're taking to make their tools safer for folks. So that'll be good to have. All right.
A non-AI story. Listen, 2024 and 2025 has not been a good set of years for Medicare Advantage companies. You could see it in all the public company stocks. There's tons of reasons for this, as we know. V28 changes, medical costs coming out of COVID. There's been actually a lot of the AI tools that providers that you referenced are now using. Plans actually have been a little slow to react to and are seeing better coding by providers. There's been some leverage put to providers to actually improve their revenue cycle management efforts, and that's we hear that payers are seeing that. Healthcare utilization's up, right? So it's been bad. It's been bad all around. And frankly, like, for the first time in my career in healthcare investing, people are like really sour on MA plans, right? And you actually see like big companies and regional blues like exiting markets, which MA used to be the gift that kept on giving to these health insurance companies. So like, that is what it is. And yet, I saw this story this week, or maybe it was last week, where UnitedHealthcare paid AARP $9 billion to help it sell its Medicare plans. And UnitedHealthcare and AARP have had a very symbiotic relationship for a long time and partnership to sell MA plans to seniors, because that's AARP's market. UnitedHealthcare, as we know, they're no dummies. They're one of the best run companies in our industry for a long, long time. So I was trying to figure out how to foot those two things, which is like, on the one hand, everyone's like down in the dumps about MA, and yet one of the most profitable, successful, long-running companies in our space is shelling out another $9 billion to continue a decade-long partnership with AARP. Clearly, they see something in the market that people don't see right now, that MA is going to come back.
Okay, I mean, my first thought is that it's a little sketchy in my mind. Like, AARP should be a watchdog pushing to contain costs for seniors, and I don't really think they can do that if their main source of revenue is United, right? So to put it in context, I looked up what their revenue is from member dues, and it's about $300 million, which is huge, right? Like, this is a huge organization. You know, we both have family members who are AARP members, and it has such goodwill with the senior community. But how can they truly be a neutral party when they're getting $9 billion? Dollars from them? I think it undermines its objectivity on Medicare matters and things that they're going and then lobbying. They're a big lobbyist. So for them to, and especially because United, as we know, they've been accused of overcharging Medicare by billions through coding maneuvers. We've talked about this on past episodes. And so I don't know. It raises the question, like, should a nonprofit advocacy group be doing this? Yeah.
Well, by the way, you said $300 million from dues every year. So this is $750 million because it's a 12-year deal. So like 2x what they get in member dues they're getting from this deal. Clearly, United is not out on the Medicare Advantage market. One of my partners once said when you want to be looking at things when they're not so hot. And so maybe there'll be a bunch of bets put on MA. And frankly, the reshuffling of the decks and people getting out of the market might be opportunities for some people to make hay here.
Totally. There's some great founders working on MA too that have been working on it. So, I hope that they can weather the storm. All right. My last story is Hims enters the menopause space. So the $11.5 billion digital health giant just announced that it's expanding into menopause and perimenopause care, including virtual prescriptions for hormone replacement therapy. It says it wants to close the gap in menopause care where only about 30% of OBGYN residency programs offer formal menopause training, and it is not shy about the business opportunity. It expects this expansion to help drive hers to $1 billion in annual revenue by 2026. Obviously, they're directly taking on venture-backed startups like MIDI Health, which has raised $150 million, and EverNow, which has raised $30 million, which are women-led startups focused exclusively on menopause. Founders like Joanna, I'm sure always hear, why doesn't Hims just do this from investors? I'm sure she's heard that more than once, and now it's happening, right? So, Steve, I'm curious what your point of view on this is. Do large horizontal platforms like Hims ultimately win out, or do you think there's room for specialized vertical players to also succeed?
By the way, first off, how great is it that hers is going to be $1 billion business? I just love the fact that they have Hims and then hers, and hopefully they have, I don't know, maybe it's folks eventually. Like they're just, Andrew's continues to do a great job.
We got to get him on the show.
I know.
We've got to get him on the show. Andrew, if you're listening, come join us.
Yeah, we want to talk to you. We talk about your company a lot. So
all the time.
Anyways. It's a really interesting question, and I'm sure Joanna and others, as you said, hear this all the time and are, probably hearing it more now that Hims made this announcement. The way I was thinking about Halle is I think there's two playbooks that are being run here. And I think these two playbooks can exist in our world. They're two separate markets. So the way I think about it is I think Hims is running a B2C to B playbook. Right? I mean, it started off mostly consumer pay, and still today, I mean, you could buy GLP-1 drugs, cash pay. You could buy, ED drugs, cash pay. But they also, I'm sure, they have insurance options too, if appropriate. You can get your insurance to cover it. And so, but I think they're mostly a direct-to-consumer cash pay, and then if you have insurance, providing that opportunity for you to use your insurance to pay for it. What MIDI and others are doing, and Hinge and lots of companies in our space do, are more of a B2B to C play, right? So they're selling to the employer or to the payer, and aggregating lives that way. And then, you know, most of the services that they provide are fully covered by insurance other than the copay generally, right? So it's a little bit of a different go-to-market playbook. For instance, MIDI, they claim that they have Fortune 100 companies. I'm sure a lot of them now, given their growth, they work with leading health systems and professionals to sort of partner in providing this care that for women, right? It's a little bit of a different strategy, and I think those two worlds can exist, honestly. And I think there are lots of examples where those two worlds exist in healthcare.
It's probably the most annoying question that investors ask founders, but it's important because you can easily get wiped out. In my mind...
Well, is it annoying? Can I ask you? Because you've been a founder. So I'm the one who asks these questions. But it also, like I always try to see the glass half full. For you and I, that question would have never been asked 10 years ago because I used to say, and I probably said it to you, DTC is DOA. Direct-to-consumer is dead on arrival. Like, don't talk to me about your direct-to-consumer business 10 years ago. And now it's real. Right. So I understand it's annoying, but the fact that we now have two options, a way to build companies in our space, to me is actually pretty cool.
I agree. I think this is a big enough market that they can both scale, right? They can both serve folks uniquely through different channels, as you said. The question is like, who's to stop HIMSS from doing the employer model as well? They haven't showed any indication that they're going to, but nothing is stopping them from that. So an investor today could also ask us that question. I think it's going to come down to consumer behavior and what you're looking for in HRT specifically. If this is something that the brand affinity matters, I think that the specialized vertical player will win. I think that if you're looking for a brand that you can trust, that you are going to be viewing it as like a clinic experience, you're choosing your provider and you're going to stick with that provider, I think 10 out of 10 times, like that is when the specialized vertical player wins because they're able to build out every detail of that, regardless if it scales to other products, because they're just focused on the menopause. But if you think that people buy HRT out of convenience and what is the fastest, most convenient, cheapest way to get it, then I would say actually a platform like Hims and Hers is going to win for those customers because they are going to be the easiest. Maybe you already have another script there, so you already have your profile filled out, so it's easy to press a button and get that script.
I think your point about experience is the right one. Like, and I honestly, like, I think I referenced my age already. I think some of the people in like generation older than us and maybe even my generation, it's like we're so beaten down by the healthcare system, we kind of expect it to move slowly. Like, you know, and I'm sure Joanna's got her team moving super fast, but even like there are just steps. Like you have to schedule an appointment with a provider because they want to provide high quality care. There's a reason for it. And I think the younger generation is like, screw that. I don't have a primary care physician. I get my Uber, I get my DoorDash, I get everything in my life super fast, Amazon. I want my hair loss medicine fast. I want my HRT fast. I want my GLP-1s fast. I want it fast. And
sometimes I want the pill mill. Just give me the pills.
I mean, honestly, there is something to speed that I think the consumer companies can get probably better because there's just less protocol, less supply-demand matching, all the things that make tech-enabled service virtual care models, I think, strong in what they do clinically also makes them probably slower.
You have to think about where digital health can shine. And in this case, there's probably a lot you can do around community, education, content that someone like MIDI is more well-positioned to do. I think about this with GLP-1s, and you and I have talked tons about this, but like where I think digital health can do better than a brick and mortar clinic is all the wraparound services, the tracking, the community, the like ideas for, food that you should be eating, et cetera. And that's where I think, digital health, there are certain areas where it just like, it's our MTS. It's our moment to shine. And so if menopause is like that, then I think someone like MIDI is ready. But for the folks who just want quick HRT in and out, like a HIMSS is going to be where they go.
Yeah. So. Well, speaking of slow healthcare systems, my last story is back to AI. And I always love like reading, getting prepared for these and just reading lots of different stories. And I found these two super dichotomous stories. One that was in the Boston Globe, my hometown paper, about Mass General Brigham, which is, one of the best healthcare institutions in the country. MGB is turning, actually, to their credit, they're using AI to ease shortage of primary care doctors. That's part of the headline. The second part of the headline is, and some of those doctors don't like it. Digging into the story, Mass General Brigham has turned to artificial intelligence to address a critical shortage of primary care docs, which I thought was interesting, launching an AI app that questions patients, reviews their medical records, and produces a list of potential diagnoses. It's called Care Connect. I was actually, by the way, walking down the street of New York yesterday with a very prominent healthcare entrepreneur who was telling me about how he actually had called into MGB because we were talking about the voice AI space and actually had really had a great experience with the AI platform because we were talking about do these AI voice bots sound real?
Is it homegrown or are they partnering with the startup?
He asked me the same thing. I didn't know. And I didn't have the time to research today, so I don't know.
Yeah.
But he actually had connected with Care Connect and had a great experience. This platform was launched in September for 15,000 patients, MGB patients who don't have a primary care doc. So a great usage, right? The chatbot's available 24/7 to interview the patient, set up a telehealth appointment with the actual physician in little as half an hour. And so sounds like an amazing, extender, right? That we've been talking about. And yet lots of the primary care docs at MGB describe the AI as a sideshow, are raising stinks about it. They call it distraction from what they contend is a real solution to the shortage, which is providing pay and working to conditions that will attract more primary care physicians to the state's system and keep them from leaving. So wow, I thought that was really interesting. And then I read this story in Wall Street Journal, literally after reading that story, which was patients are diagnosing themselves with home tests, devices, and chatbots, a DIY strategy, if you will, for basically self-diagnosing. And I thought, gosh, MGB, good for you. Way to adopt AI. And yet some of these doctors, you're like, oh my God, the writing's on the wall. Patients are already doing this themselves. And so why wouldn't you want a co-pilot to help you? Again, to your point, is our health system just going to be too slow to move on this stuff? And then we're going to have these consumer-focused companies which present their own risks, but present speed and expertise nowadays with the LLM.
And getting into a PCP is not easy, and you don't get time, and they complain about you coming prepared. So wow, fascinating. I love to see this. So last week I asked Dr. Holly Urban what she thought about the idea of PCPs having basically a digital twin so that their patients, their cohort of patients can ask questions, and basically it's trained to be how she would answer those questions. And she was actually a clinician who was really bullish on just more use of AI to democratize care for patients and physicians. So I think it's really exciting. I love to see this coming from the hospital versus something that they're going to be forced to adopt in 10 years because this is how people are seeking care. The part about the story that you shared that is wild to me is they think that the solution is paying doctors more, because that is the problem with healthcare. It's too expensive. It's too hard to get in, and people are being left out. And so it feels like actually the solution is AI. The solution is using software to kind of scale care. The solution, we're not going to be able to afford higher salaries in healthcare without increasing prices for patients. So
unfortunately, there's a primary care desert because primary care has been for a long time not appreciated in its importance as the quarterback, and frankly not compensated that well, and therefore not surprising that folks who have to go through 7-10 years of training and pay for it to become a doctor choose to go to the higher revenue specialties. That's not shocking. It's funny, this story to me highlights one of the things that when I've said it before, we are going to see this, I don't know when it is this sort of health systems and doctors are some of the most well-compensated, most prestigious people in every single MSA, metropolitan area in our country, and frankly have a lot of political sway, as we know. And the war of how this is going to be played out, and obviously AI is going for lower level jobs right now, but ultimately lots of people believe it's going to go, it's going to replace some higher level jobs. And I'm not saying it's going to fully replace primary care, but there's going to be a battle to be fought among the very politically entrenched and well-off sort of doctors associations and regulators of this stuff. Ultimately, I think that's where the battle is going to be waged of how far is it going to go, and how much pushback is there going to be for these things to be adopted.
So much to think about.
Yeah.
All right. Well,
that was an hour and we covered a lot of ground. That feels like this year. Like you said, it's been an incredible year.
Yeah.
So
it has been. So, my birthday's tomorrow. So next time you see me next month, I'll be a year older.
Happy birthday.
Thank you. Thanks, Steve.
And you're already wise, so you can't get a year wiser.
Well, listeners, we have so many great episodes coming up. So if you are not yet subscribed, subscribe to the show. Leave us a review. We appreciate you tuning in every single week. We love producing this podcast for you. So have a great November, and we will see you soon.
Thanks for listening to The Heart of Healthcare. If you enjoyed this episode and you'd like to support the podcast, please leave a rating and review, and don't forget to subscribe. The Heart of Healthcare is produced by Halle Tecco and hosted by Michael Esquivel, Steve Krause, and Halle Tecco. The show is engineered, edited, and mixed by Kyle Moore. Visit our website, heartofhealthcarepodcast.com, for show notes and details.